All right, well, welcome. We're here at the senior station. We're here for our latest edition of What's Up, Doc? It's been a couple of months. We've taken a break for the summer, but fall is back. We're back into the full swing, so welcome. I'm here with a bunch of healthy, energetic, early rising seniors in Portsmouth. Let me hear it from you, seniors. It's a time. How about that? You can't beat Portsmouth for active seniors. Look, you know what? Have you noticed it's getting a little bit cool out? Somebody was telling me they had a cold on the way in here. Fall is here, November's here, and we do start seeing some illnesses. So I want to remind you all, it's flu shot time. We're giving flu vaccinations, and we're also, for seniors, we recommend pneumonia shots. How many people in the audience have already gotten their flu shot this year? Well, good. Now, I heard a not me, so there must be a reason there. I'm going to ask about that. But I would encourage you to get a flu shot. Good job, sir, because we know that flu shots are safe and prevent flu 70% of the time. And this year, remember last year we had to get 2. This year, it's all in one. They're combining that swine flu and the regular shot together. And that's once a year. So every year a new flu strain comes, so you need to get updated every year. And then we recommend one time, if you're over 65, at least one time getting a pneumonia shot. How many people have had their pneumonia shot? All right, so about half. Well, I would encourage you to ask your doctor about that too. That's an easy one, and usually it's just a one-time deal. But we're not talking about the flu today. We've got an unusual and I think very interesting topic today. Have you ever known anybody, or maybe have you ever had a little bit of shaking, what we call tremor? Yeah. Okay. We notice that as people get older, sometimes we frequently see an increase in the incidence of tremor or shaking. And as it turns out, there's a variety of reasons why you can have shaking. So I've got a special guest, Dr. Dickey, who's an expert on tremor, is going to talk to us and answer some questions about tremor, what causes it, how to look for it, what we can do to treat it. So come on back and join us on What's Up, Doc. We'll have Dr. Dickey on. Welcome back. We're here at the senior station in Portsmouth with our latest episode of What's Up, Doc? And we're talking about an unusual topic, but actually I think a pretty interesting topic we don't really hear. We're always talking about, you heard me talking about the flu or exercise or eating healthy, and those are important, but tremor is something that patients ask me about a lot. We've got Dr. Dickey. Welcome. Micah Dickey is one of my partners, and thanks for joining us. Tell us about yourself.
Thank you very much. I'm Dr. Micah Dickey. I'm a third-year family practice resident. My wife is actually getting ready to have our first baby, and I'll be practicing in California at the end of the year in July.
These hard-working doctors, he's been separated from his wife for almost the last year. She's a doctor in California, and he's a doctor here. These young doctors have to go through the time. Can you imagine your wife's getting ready to deliver, but congratulations. Thanks for joining us.
Thank you very much.
So, tremor is the medical term, Dr. Dickey. What do we mean by tremor?
Tremor is basically any involuntary movement. It's an oscillation type movement, so you have a frequency sort of thing, and it can occur in your hands, legs, head, tongue, any part of the body. But it's basically an involuntary oscillating type rhythmic movement.
So people probably don't use the term tremor. They may talk about shakes. Is it the same as shakes?
Yes, it's the same thing as a shake.
Okay, and so I know people that I see have that, worry about that. I guess they always think maybe it's a bad thing. Are there many things that can cause tremor?
Yeah, there's several different types of tremors, and tremors actually, it's very common. It's the most common movement disorder in medicine. Some estimates say it's as high as about 22% of people have tremors. It's probably a little bit closer to 5%. The most common types of tremors that we see is the postural action type tremor. It's a tremor, it usually occurs both sides of the body. Things can exacerbate it like caffeine, certain medications, anxiety. Usually alcohol can make it better, and it's just one of those things that kind of occurs. It's more common in elderly people. I'm going to demonstrate the postural action tremor. This particular tremor is called a physiologic tremor. I'm going to have Dr. Bukowski just hold this piece of paper in his hand and kind of show you what I mean.
So people always think about tremor, they're always worried about, do I have Parkinson's? But what you're talking about isn't Parkinson's here. Can you all see that paper shaking?
Yeah.
So you can see the end of the paper here. Everybody has this. It's called a physiologic tremor, and anybody at rest, or when he's holding his hand against gravity, that's the postural tremor, he's keeping his hand up, he's got a little bit of shaking in the paper here.
So I'm using my muscles. I'm not particularly nervous, but do nerves make this worse if I'm anxious?
Nervous, and Dr. Bukowski probably had a couple cups of coffee this morning.
3 cups of coffee. 3 cups of coffee. So caffeine, sure enough, can make that. And have you ever noticed when you drink too much coffee, you shake? So there's a good example of that's a sort of not a bad kind of tremor.
And the good thing about this is it looks like he did not have his shot of whiskey this morning, and that's why he's got the tremor still.
I did not. And even though alcohol helps us, we don't necessarily recommend drinking.
We don't recommend drinking to stop this.
Alcohol can cause some other problems too.
This tremor is totally normal. Certain things can exacerbate it, and it can still cause a functional issue. It may cause difficulty eating soup, difficulty drinking, cups of coffee and those kinds of things. And there's certain things we can do to treat it. Most of the time, if it's a physiologic tremor like this and it's exacerbated, we want to stop whatever the offending medications are that are causing it.
So caffeine is something to keep in mind, too much caffeine. Or another good example I just thought of, have you ever gotten really scared, something like maybe you're almost in a wreck or you almost hit somebody and your adrenaline goes up and you start shaking? That's another example of that kind of physiologic, kind of normal tremor from adrenaline, from too much stress.
Absolutely.
Yeah. What about other kinds of tremor?
Well, the other tremor under this postural action is called an essential tremor. And that's a tremor that can occur, the same type of thing, but it's usually a little bit more exaggerated. And that's usually something that occurs over a very long period of time. It's the most common type of tremor, and there's peaks at about 20 years of age and 60 years of age when this tremor gets more in effect. Some other different types of tremors in different...
Well, before you leave that one then, because that's probably the most common kind we doctors see and people worry so much about, but it's not particularly a worrisome kind, right?
Absolutely not.
So this is when you're doing something, you're using your muscles, and so a good example would be you're drinking a glass maybe?
Yeah, well, it's very similar to the postural action tremor. It's a little bit more exaggerated than the other.
And I see this a lot of times. Patients worry about this. Say, Dr. Bukowski, do I have Parkinson's? And it's not. It runs in families, I guess.
And the easiest way to kind of distinguish between the two, between Parkinson's and one of these more benign tumors, is it's usually both sides of the body. It's usually been going on for several years. It occurs later in life, and it's a tremor with holding your arm against gravity or something like that.
Now, the older folks like me in the audience probably remember a famous actress, Katharine Hepburn. Do you remember how Katharine Hepburn's head would shake? And even her voice had a little bit of a tremor in it, and that's a good example of this familial, sort of benign essential tremor, although it can be bad enough that it can affect your head and stuff too. But once again, not a deadly thing that causes any bad consequences.
Exactly.
Do you remember Katharine Hepburn?
I do not.
She was a great actress.
I'm sure she's a very nice lady.
Okay, and then, go ahead.
Another type of common tremor is an intention tremor. And this is a tremor that usually gets worse while you're making a certain movement. And it usually gets worse towards the end of that movement. So I'm going to have Dr. Bukowski demonstrate. He's going to touch my finger with his finger, and then he's going to touch his nose again.
So sometimes you'll see us doctors do this. So so as I point to his finger, when I get close to the end, it gets worse.
Exactly.
Like, gets mild, more worse right there. That's an intention tremor.
That's an intention tremor. And common causes of this, strokes can cause this type of tremor. Multiple sclerosis can cause this type of tremor. And when you have a tremor more like this, it's important to see your doctor and have a neurologic exam to make sure that there's no other deficits. Again, if it's something more malignant of a cause, such as a stroke or multiple sclerosis, it's usually going to be one-sided only. So while Dr. Bukowski would have the tremor using his right arm, if he used his left arm, it may not be as pronounced.
This side.
Exactly.
So now we're talking about a little bit more dangerous kind of tremors there.
Correct.
Not that just sort of shaking when I do things, but specifically at the end, and it's just one side, and strokes you mentioned, or some other. So that'd be an important one. Mm-hmm. And then, gosh, we always hear about Parkinson's. My patient always asks me about Parkinson's disease. What about that?
So the last type of tremor is a resting tremor. So we talked about tremors against gravity. We talked about tremors with action. Resting tremor. And Parkinson's usually falls into that category. And the most common type of tremor you'll have is called a pill rolling tremor. And that's when the tremor affects the muscles in your fingers. And it's sort of a pill rolling tremor like this at rest. It's usually something that occurs, you're not doing anything else. And again, sometimes you can have a resting tremor with an essential tremor, but that's usually if you've had a tremor for many, many years, and that's how it develops. Now, just because you have a tremor like this at rest does not necessarily mean you have Parkinson's disease. There's a lot of other things that go along with Parkinson's, including gait difficulties, difficulties in muscle tone, where some people can have what we call cogwheel rigidity, and other sorts of things in the disease spectrum of
Now,
Parkinson's.
by gait, you mean trouble walking.
Trouble walking, and sometimes it's sort of, we call it a shuffling gait, and it's where it's difficulty to take broad steps, and they're kind of, shuffling along while you're walking.
Like, have you ever seen folks walking like this? That could sometimes be a sign of Parkinson's. And then that key that Dr. Sigge said is when your hand's at rest and you have that little pill rolling tremor. So, but sometimes you have to go see the doctor to decide these things, right? What would doctors look for and what would they do?
Well, if there's any concern that you're having a tremor, if it starts affecting, as I was saying, if you feel like you're not able to eat soup, you're having difficulty riding, difficulty with fine motor movements, it's important to see your doctor and have it checked out. Most of the time we can diagnose the type of tremor based on a good history, just you kind of talking to us about what this tremor occurs. But most of the time your doctor is also going to perform a pretty thorough neurologic exam, including what we showed you with Dr. Bukowski, touching my finger, probably some component of walking, and some component of reflexes in the exam as well.
And then if you're worried about a stroke or something, you might even do some studies.
Correct. If something comes up on the neurologic exam or the history that we're a little bit more concerned about, we always have the option of going a little bit further. And we have CT scans where we can image the brain and MRIs where we can look for signs of stroke that occurred in the past.
Well, finally, let's just end it up on, if you do have some of these tremors, are there treatments that will help?
Absolutely. A lot of these tremors are controlled by removing the aggravating factors. So for some people, it's certain medications that we may be able to take out to prevent these from occurring. And the other thing is we actually do have medications that we can give for essential tremors. And it's the same medication that you might take for blood pressure, and it's a beta blocker type medication. And that can help a lot of people in alleviating these tremors and improve their ability to do a lot of the activities of daily living that they weren't able to do with this tremor before.
And then don't forget, some of the things we do make it worse, like caffeine I mentioned, and so you always want to watch out for that. Well, that's, I think, really interesting. You showed us some good stuff, and so let's take a break, and we're going to come back and see if the audience has any questions. Come back and join us on What's Up, Doc.